Ladies and gentlemen, now is the time for keynote speech. Please welcome the speaker, Dr. Ingrid Daniels, Director of CAPE Mental Health in South Africa, President-elected World Federal for Mental Health. The topic of the speech is the World Health Organization and United Nations goal setting for prioritizing mental health promotion. 世界卫生组织和联合国为优先促进心理健康制定的目标。Please welcome Dr. Ingrid Daniels.
Good morning, ladies and gentlemen. Thank you. It's a great honor to be in this beautiful city, Taipei, and this beautiful country, Taiwan. I have been very impressed by your Vice President and the commitment to mental health. Professor Chang, former President of the Mental Health Association of Taiwan, and Dr. Liu, current President of the Mental Health Association of Taiwan. Thank you for inviting me and to do your keynote address. Delegates who are present, I hope I get to meet you during the course of the 2 days. And I believe we are all here as mental health advocates, but also as mental health activists. And so this morning I want to speak to you about prioritizing mental health promotion. I've been asked to speak to you about the World Health Organization and United Nations goal setting for prioritizing mental health promotion. So that's going to be a bit of my focus. Strategies for country level implementation and the role of international non-government organizations and non-government organizations in advocating for country level implementation. But I think before I can actually speak to you about the topic itself, I would like to sketch the global context. And ladies and gentlemen, the global context is such that about 450 million people suffer from mental disorders, which is among the leading causes of ill health and disability worldwide. 1 person in every 4 will be affected by a mental disorder at some stage. So it's very prevalent. All of us can be affected at any time. Mental, neurological, and substance abuse disorders exact a high toll on health and accounts for 13% of the global burden of disease. But most concerning is the fact that depression will be the #1 global burden of disease by 2030, surpassing heart diseases, cancer, and I think that causes great concern for us globally. But I think of more concern is the fact that every 40 seconds someone dies by suicide. So I'm afraid the statistics are quite concerning. And I don't think we can start talking about prioritizing implementation without understanding why this is so critical to the World Health Organization, including the United Nations. So, having that as background, what is even more frightening is the fact that 50% of people with mental disorders in high-income countries, I'm talking about high-income countries, receive no treatment. The statistic is even more concerning when you look at lower and middle-income countries where only 85% of people have access to treatment. That sketched against the global statistics causes us to really look at what is this response to this global mental health crisis. So thus, the World Health Organization and the United Nations have prioritized and set goals to reduce the incidences of mental disorders globally. The World Health Organization stated that at the core of their objectives and functions in their commitment to mental health promotion, or if it is to be achieved, mental health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So the World Health Organization is very clear about what it wants to achieve. They've also established the Mental Health Action Plans 2013-2020 objectives. And these objectives, ladies and gentlemen, A, is to strengthen effective leadership and governance for mental health. Now, if we have no political leadership, I'm afraid we're not going to see the kind of commitments we heard this morning by the Vice President of Taiwan. We need our country's leaders to commit to making the changes required. The World Mental Health Action Plan 2013-2020 further states that it provides comprehensive, integrated, and responsive mental health and social care service in community-based settings. So the days of mental health or mental disorders being seen as basically a condition that needs a biomedical approach is over. We need the combination of both biomedical as well as psychosocial interventions if we want to see the reduction in the incidences of a mental illness. But I think most importantly, and for this conference, the action plan objective also states that it wants to implement strategies for promotion and prevention of mental health, to strengthen information systems and evidence and research for mental health as well. The overall goal of the action plan of the World Health Organization in response to this crisis is to promote mental well-being as a start and prevent mental disorders, provide care, enhance recovery, promote human rights, emphasizing promote human rights, and reduce mortality and morbidity and disability for persons with mental disorders. The further response from the World Health Organization has been identified. Prevention of mental disorders and promotion of mental health as a priority objective. So it is the priority of the World Health Organization to promote mental health and to prevent mental disorders. And this is a key objective under its global plan, aimed at reducing the gap in mental health services, and identifies the most effective strategies across different cultures. So it is sensitive to communities and countries around the world. The further response is that the World Health Organization again sees promotion and prevention as an overlapping complementary of activities. Prevention, as we know, is concerned with avoiding the disease, while promotion is about improving health and well-being. So what is the response from the United Nations? Well, the United Nations response to this global crisis is the overlapping functions have been to provide, first, their role is to provide human rights mechanisms and instruments for universally accepted values and principles which can guide countries in the design and implementation, monitoring and evaluation of mental health policies, laws, programs, and generate accountability for mental health, and thus offer useful standards against government's performance. So we have a role as mental health activists at country level to monitor our governments and their implementation. The United Nations sets the standards, it provides the mechanisms and the instruments. Mental health remains one of the most neglected global issues, even though it is critical to achieve the 2030 Sustainable Development Goals. Adopted by all world leaders, there is this recognition that mental health needs to be prioritized. The United Nations Secretary General said that the United Nations, in its focus to reduce the incidence, is committed. They are committed to working with partners to promote full mental health and well-being, not of some, but of all. And I think what has become very critical is that when we look at World Mental Health Day this year, it is on every high-level agenda, World Health Organization as well as the United Nations. So the United Nations Sustainable Development Goals wants to leave no one behind, and this is a major aspiration. And so when we look at specifically the Sustainable Development Goals, the World Health Organization sees the urgency to act now. And what we see for the first time is a clear identification of mental good health and well-being. So when we look at specifically the strategies to implement promotion and mental health, I want to take us back to the mental health action plans of the World Health Organization. There are 4 objectives. I'm going to focus on only one, which speaks to the focus of this conference, and it's Objective 3, which says, Objective 3 says that we need to implement strategies for promotion and prevention of mental health. And the actions that are required, and this is where country level and the role of NGOs become critical. At country level, we expect to see multi-sectoral strategy that combines universal and targeted interventions, promoting mental health and preventing mental disorders, which extends across all sectors and all governments. So what is important here, it is everyone's business. Mental health is everyone's business. And the World Health Organization is very clear about this. The second action looks for broad strategies to reduce stigmatization and discrimination and human rights violations against people with a lived experience. And if you speak to anyone with a lived experience, they will tell you that the greatest barrier in life that they face is society's attitudes towards them. And stigma is often even bigger than the diagnosis. And then the third action, which speaks very clearly to the focus program of the World Mental Health Day, which is mental health promotion and suicide prevention. An action which says that for suicide prevention, we need to develop and implement comprehensive national strategies for prevention of suicide and special attention to vulnerable groups. The World Health Organization goes further and it says these are the 3 broad strategies under actions under Objective 3. However, they are targets. So the target set by the World Health Organization in its Mental Health Action Plan, it says that 80% of the World Health Organization members will have had to develop and update their policies and plans for mental health by 2020. Now, ladies and gentlemen, that's next year. And I'm not sure whether that has been achieved. 50% of member states will have developed updated laws for mental health. 20% increase in service coverage, upscaling of mental health, interventions for severe mental disorders, and again, 80% of member states will have at least 2 functioning mental health promotion and prevention programs. And the 5th target, 10% reduction in the rates of suicide per per 1,000 in any country. We heard this morning as well that when we look at the United Nations, they are talking about a reduction of 1/3 of persons affected. And so 80% again of member states will be routinely collecting and reporting on at least one set of core indicators. And I think what is important is that many of our countries are signatories to the resolutions passed. And so it begins to point a kind of trajectory around what is the role that we have to play to see that these targets are achieved. Now, this is where the value of non-profit organizations or civil society organizations or non-government organizations have. The one amazing role that we play is that non-government organizations internationally or locally have a natural connect with the communities they work in. They know the needs, they speak to the people every day, and they have a closer connect. Non-government organizations provide a certain depth and openness to engage around what would be the best mental health outcomes. Giharelli, Rusa, and Annadale 2014 says that civil society organizations can engender forms of active citizenship by stimulating and coordinating structured interaction between healthcare users and providers. In this context, they play a valuable role of lifestyle modification for which they are often more credible than often state. And so you see that the role of the nonprofit organization in ensuring country implementation becomes quite critical. And when we look at the roles that NGOs can play in implementing the strategies for the promotion and prevention of mental health, they have stakeholder advocacy and lobbying interests. And they are better placed as civil society organizations to lobby for the rights of persons with a lived experience. They work very closely with mental health advocates, and these advocates are often people with the lived experience, and they can advocate for the rights to community-based psychosocial interventions, for better investment and funding of mental health programs. Non-profit organizations or NGOs also advocate for the greater inclusion of persons with a lived experience in disability rights initiatives. The disability rights movement is a strong movement, and they talk about nothing about us without us. And so with our mental health, users with a lived experience within the movement can be very powerful for moving agendas and ensuring country-level implementation. And then also, non-government organizations often step in when governments have failed. And they play a very important role in implementing programs and actions to combat stigma, discrimination, and human rights violations. They partner very naturally and almost seamlessly in the development and implementation and promotion of mental health programs. Some of the actions can be at country level, national and local media awareness campaigns, anti- and postnatal mental health care, early child and parent interventions, reduction in harmful substance abuse, reduction in prevention of gender-based violence, involvement in dealing with the prevention of adverse trauma-inducing events, school-based mental health programs, and I'm fascinated and interested and congratulate the organizers to see that there's such a strong focus in the program as well. Mental health in the workplace and back-to-work programs, enhancing self-help support and psychosocial rehabilitation for recovery, use evidence-based traditional practices for promotion of mental health, social media, powerful for the promotion and prevention messaging, and many others. And this is what can happen at country level, through partnerships, through collaboration, most importantly, with the users with the lived experience. And then the options for implementation around suicide prevention. The third action of the objectives 3 would be identifying risk groups, optimizing psychosocial support and counseling, to improve health systems' response to suicide, restrict access to harmful substances, promote responsible media reporting, public and political media awareness is critical because often the language we use speaks very strongly against recovery and facilitates stigma and discrimination. But as well as developing comprehensive national and local strategies to increase investment in mental health. So these are the options around suicide prevention as the third action. But there has been discussions because 2020 is around the corner. Have we actually implemented the plans? And so the World Health Organization, in its reflection with member states, civil society representatives, said actually when they looked at the mental health gap at country level, they felt that the World Health Organization themselves need to publish more timeously their atlas for country profiles. They need to strengthen the capacity at country level and appointing technical trained staff, including leadership courses. So a lot of focus on governance and leadership. And to leverage other activities and initiatives regarding certain pandemics and conflicts and disasters to strengthen the case for mental health. Also looking at best practice experiences, they felt that there could be a lot more learning materials and to reward good achievement and innovation. And utilizing other World Health Organization and United Nations mechanisms. When they did the further reflection and evaluation, they identified that they could be working a lot more closely with civil society in including people with a lived experience. And they said that they wanted to do this on a global scale, as well as regional and national advocacy movements, especially led by people with a lived experience. And to recruit people with lived experience as staff. How many organizations, when rendering services, actually includes people with a lived experience to assist and render services? Obviously, they have the experience and the knowledge, and would be better in advocating and supporting peers as well. And to have stronger collaboration with international and, more importantly, national professional and civil society organizations and federations. They went a step further, and we all know that the World Economic Forum, there has been a huge cry and plea for more financial investment in mental health. And so when reviewing the action plans, they felt that there needs to be a bigger approach to foundations and corporations for accessing funding. Proper due diligence for conflicts of interest needs to happen first of all, but greater investment at the end of the day. To approach development agencies, to make better efforts at country level, and to use currently available funds for more efficiently and effectively running programs. So there's no doubt about the financial investment required. And it continues to look at itself. And the next steps that the World Health Organization has taken that, and some of you may know this, that the Mental Health Gap Forum will be held from the 14th to the 15th of October in Geneva. And the theme of the forum is enhancing country action on mental health and reflecting on the vision of the World Health Organization's 13th General Program. And this meeting is critical because it's going to review whether countries have actually implemented the actions and resolutions signed. These are high-level meetings. The World Health Organization Special Initiative for Mental Health says that in looking at upscaling, we have to take into account universal health coverage for mental health and look at the strategies to advance policies, advocacy, human rights, and scale up quality interventions and services for people with mental health conditions. So in conclusion, international non-government organizations and local NGOs play a critical role in translating and voicing recommendations from resolutions to effect programs for promotion and mental health and prevention of mental disorders. In so doing, holding governments and all role players accountable for the responsiveness required. That non-government organizations in partnership with persons with a lived experience are central. They have the ability, they are structured in that way, to identify needs, gaps, and to provide creative solutions to prevent and promote mental health. Some of the interventions don't have to be very costly. It requires creative abilities and thinking out of the box. The functions that civil society organizations play in ensuring healthier populations, they do this by empowering people living with mental health conditions to gain greater control over their health. Civil society organizations also have the ability to change and shape the discourse, the phrasing, and shaping words that we use when we speak about mental ill health. Non-government organizations play a very important role in shaping research and the kind of research and training that is required in mental health. And direct lobbying to convince the elected officials to approve pilot programs for upscaling. Direct services to persons with mental health conditions. Non-government organizations also have the ability to influence the changing of laws and policies that violate the rights to appropriate care. And this can be used by a number of strategies, including legal challenges and lobbying. So over the past decade, ladies and gentlemen, there have been numerous World Health Assembly resolutions which have been related to the prevention and promotion of mental health. These resolutions urge member states to take steps to prevent mental illness and to promote mental health, and have provided information and guidance to implement suitable strategies and interventions which are context sensitive. However, we all know this for sure, that the pace of implementation has been incredibly slow and has been a major barrier to upscaling of mental health care. The implementation of strategies proposed by the World Health Organization, signed off by member states, however, depend largely on the leadership, the political will, intersectoral collaboration with multiple partners to coordinate efforts and programs, but most importantly, and I've said this several times and I can't say it more than I have, and I will continue to say it, it has to include persons with a lived experience at community level. Their voices need to be considered and recognized. They have the right to be heard. the right to ensure that their lived experiences and recommendations for improved mental health care translates into appropriate laws, policies, implement strategies, and most importantly, access to services at community level. So, I want to quote one of the most known human rights activists, Martin Luther King Jr., who said that we are confronted with a fierce urgency of now. There is such a thing as being too late. And if we look at 2020, I think we are a bit late. This is no time for apathy, ladies and gentlemen, or complacency. This is the time for vigorous, positive actions. And those actions, ladies and gentlemen, for us to provide access to mental health care, to reduce the incidences and increase access, the time is now. Let's make mental health a priority as advocates as well as activists. The gaps remain large and people remain ill. And that in itself is a human rights violation. And so if you're in South Africa, the weekend of the 26th and 27th of October, I invite you to the largest mental health promotion event on the continent of Africa, which is a kite festival with about 18,000 people who come. And we want to raise awareness about mental well-being. We want to raise awareness about suicide and suicide prevention. And our message is #LetHopeFly. We need to give back hope. I thank you, ladies and gentlemen, for listening to me this morning. Thank you.